these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office. Experts on what they're talking about.
This is the podcast
For insights into the issues.
China, bioterrorism, Medicare for all. In-depth discussions.
Breaking it down into simple terms. We hold
these truths.
with Dan Crenshaw.
The Eagle has landed.
Welcome back to Hold These Truths. Today we are going to talk about the big issue of the day with our special guest here, Dr. Ji Bai. Thank you for being with us. And she, of course, has some expertise on this particular issue. What are we talking about? We're talking about these subsidies, these healthcare ACA subsidies that Democrats have shut down the government for, while also claiming they're not shutting down the government. But that's not what we're going to talk about today. We're going to dive deep into what the heck they're even talking about, okay? And the Affordable Care Act, how it was created, what kind of market incentives it created, what these subsidies did to those market incentives, what they were meant to do, and what Democrats are claiming, and what the truth is. Okay, so we're going to get into all that. Dr. G, you came across our radar. You wrote a good op-ed in the Wall Street Journal recently, really laying all of this out on why the expiration of these subsidies is, one, it's not catastrophic, and two, it's our first step back into allowing some kind of market mechanisms to take place, which in the end actually reduce prices for consumers on a very fundamental level, as opposed to masking it with subsidies, right? So I want to read a little bit about your bio, just so people understand who you are. She's a professor of health policy and accounting at Johns Hopkins University. Obviously been ringing the alarm on one of these most misunderstood pieces of the healthcare debate right now, which is these COVID-era expansion of Obamacare subsidies. And you've done more than that. You've been a fellow at the Congressional Budget Office as well. So we're talking to somebody who knows what they're talking about here. So appreciate you being on. I want to start with just Obamacare generally. Let's do Obamacare 101 real quick. We've done that before on this podcast, but not every listener has listened to all 300 plus episodes. I don't know why. I mean, it's a great podcast and they should give it 5 stars. But let's start with Obamacare 101. What was it designed to do, and then what did it actually do?
Right. Obamacare was trying to make insurance affordable. But as a result of all the regulations, the insurance becomes very unaffordable. But in order to pull people in this pool, Obamacare did 2 things. One is by state force to compel people to join, which we call individual mandate and employer mandate.
Right.
And the second is to bribe individual to join through this premium subsidies to make the premium look affordable, which is actually unaffordable caused by the regulations. So that's really the essence.
Yeah, I mean, on a fundamental level, the Democrat Party, they have one metric that they care about, which is the number of people insured. To them, that's the ultimate metric for healthcare. But of course, healthcare is a little bit more complicated than that. And we'll get into some of the problems here. It's more complicated, especially with Obamacare, when it looks like 1 in 5 claims are denied. Medicaid is not taken by a lot of doctors, and a lot of what Obamacare did too is through Medicaid subsidies was basically put a bunch more people on Medicaid. And so you get to say that you're insuring more people, but you've effectively crushed a market. And maybe let's dive real quick into those regulations that you say. Kind of these one-size-fits-all regulations. What are those, and why were they bad for the market?
Yeah, I call Obamacare junk insurance with outrageous premiums. Following Mike Cannon from Cato's words, there are 3 major regulations Obamacare did to transform our individual markets. The first one is to dictate what kind of services should be covered. For example, gender-affirming care have to cover. Prescription drugs, even very cheap generic drugs, have to cover. Yeah. So all these comprehensive coverage requirements make the insurance premium very expensive.
And the thing is, not everyone needs these things.
Exactly. I'm 50F straight. Why do I need gender-affirming care?
Yeah, or I would be covered for I don't know, having a baby.
Exactly.
Things like that. So it's So in their minds, they think they're doing this like simple thing, but in reality, in an insurance market, you do have to tailor it to what people's needs actually are.
And only market can dictate, not the politicians, not bureaucrats, right? You cannot dictate saying these are important services you must cover. That's wrong.
Yeah. And okay, well, what's the second thing?
The second is to dictate how much variation should be across people in terms of premiums.
Okay.
So if you are healthy, you eat healthy, you work out, your premium have to be relatively close to me. Let's say I don't work out, I eat not unhealthy. So that is to squeeze the variation and forcing the healthy and the young folks to subsidize the old and unhealthy.
And so what happens is young people just don't even take it up. Like a lot of people were, back when there was a tax, remember we got rid of that.
Right.
In 2017, there's still a mandate, but it's a $0 mandate. So we kind of got rid of it. But when there was a tax, and I think it was like $900, I think people would just be like, yeah, no, I'd rather just pay that as opposed to paying for this junk insurance, right?
Exactly.
It was, it just didn't do at all what they said it was going to do.
The third thing, if I may add,
Yeah.
is to dictate how much profit margin insurance company should have. So basically, it's transferring money to them, saying if you have $100 premium, you take $15.
For administrative costs. That's interesting. This is an interesting one.
That's
because-
medical loss ratio.
So, and what's interesting about it is like on the surface, I'm like, well, at least that part's okay because, these insurance companies have made a ton of money off Obamacare, right? Like, I mean, God, if you invested in insurance companies back for Obamacare, I think you'd be making a lot of money right now. So obviously this cap on profit wasn't that much of a cap. And tell us about, and it actually creates a perverse incentive. So tell us what that perverse incentive is.
It actually kills the small ones.
Yeah.
So bigger ones, you have a diverse pool and you have geographic different markets. It's easier for you to meet the target. But small ones have a harder time. So that creates an uneven playing field. That's number one. So number two is when the insurance companies trying to offer some innovative products, you are less likely to meet the target. So that's basically create a disincentive for insurance companies to offer affordable and flexible products.
And there's no incentive to offer those, but also they're not even allowed to because of those first two regulations, right?
But there's some
things
let's say
there's some things they
health,
could do.
right? They
Okay.
can do, but now there's no incentive to do that.
There's no incentive.
The most important one is that they create a strong incentive for insurance companies just to expand the pie. Once the pie is big, then the slice of 15% also big, right? So can you imagine any insurance company want to reduce premiums to control spending? No way. That will completely affect their total revenue.
Yeah, and I want to hit on that point just a little bit harder. So 85% has to go to the patient, right? So the insurance company knows that, and they're doing their accounting, and they're like, all right, well, that means we only get so say premiums are $100. Okay, so we only get 15 of that. What if we make premiums $200 and then we get $30? And that's what's been happening.
Yes,
and so
at year end, they're doing that all the time. They don't want to give rebates back as required by ACA, that saying that if you don't meet the medical loss ratio, you have to rebate it back. They don't do that. At year end,
we're not enforcing it?
I thought, so they're massaging the number to meet the requirement by doing what? By increasing the medical spending. So you'll never see premium decline.
And it's almost impossible, I guess, for us or us being like HHS to dive into that and audit it and figure it's a very difficult thing to enforce.
Exactly. And people might blame insurance companies for greed. I disagree. I believe this government created this very bad incentive, poisoned the soil.
Companies are greed is a bad word, but like companies are profit driven.
Exactly.
What do you expect them to do?
Right.
Yeah, I know. I agree. And I kind of call them out as being like sort of the bad guys. But in the end, we could make them not the bad guys.
Exactly.
We could. I'll talk about this maybe at the end on solutions. But I always find healthcare interesting because it's the only thing for low income people. So it's a thing we've identified as a need. I don't think it's a right. I don't know what your opinion is on.
Totally agree.
Yeah,
it's a commodity.
It's a commodity that people need, right? Just like water. I mean, but like, I don't have a right to force someone to get me water. I don't have a right to force a doctor to do a surgery on me. That's a positive right, as we would call it in political philosophy. What we have in America are negative rights. I have a right not to be punched in the face by you. I have a right not to be having malpractice done on me. Okay, but that's defensive in nature. It's called a negative right, and so
that's very un-American.
Yeah, it's not what we do, right? It's a service, but it is a service we want people to have. Like we do agree on that, just as a general American concept, right? Like by law you have to treat somebody at the emergency room. Okay, so we have to meet in the middle somewhere. It's a service we want people to have. And, I guess there was some good intentions with Obamacare. I do think the real strategists behind Obamacare were trying to screw up the market so bad that we'd eventually have no choice but to enter into a single payer system. And there's plenty over the years who have said like, oh yeah, that's the goal, and I have other proof too, which is like, I said this on CNN the other day, we passed a bill out of the House called the Lower Cost, More Transparency Act, right? But good bipartisan bill, passed it out of our committee, 320 votes. We didn't even have to do a rule. It was passed on suspension. That's how good of a bipartisan bill it was. This was in 2023. And that was back when the Senate was controlled by Democrats. And we're all wondering, why the hell? This is just price transparency for across the board. It was a really far-reaching one for insurers, for hospitals. You can't fix the pricing problem if you don't even know where the money is and who's charging what and what something costs. That's the whole point of the price transparency debate.
I agree there.
And it's bipartisan, at least in the House. But Bernie Sanders chaired the Committee for Health, Labor, and Education. Is that what it is in the Senate? Yeah, they have different names for their committees, so I kind of forget which ones are which. But anyway, he never took that to the floor. Schumer never allowed it to come to the floor, even though it had 320 bipartisan votes. And you just got to scratch your head and wonder, like, what is your real goal here? Your real goal is to continue to obfuscate the market and screw it up, because your real goal has always been Medicare for all, or Medicaid for all, or single payer, or whatever the hell you want to call it. All right.
I believe they always follow a four-step process. So first, detach patients from their healthcare dollars, then turn free enterprise.
Oh, yeah, that's what I was going to get into, but please go ahead.
Into cronies, right? Because now the money comes from government, not from patients.
You don't see it.
So turning into cronies.
Which is totally different than how we do housing or food stamps, right? Like we give the person money, and we don't give the grocery store money.
Right.
That'd be weird. All right, it's just, but for some reason in healthcare, we're like, no, we're going to pay the insurers.
Yeah. Exactly. And then number 3 is to regulate, to raise the price.
Yeah.
And the end of all regulations is higher price. And number 4, blame the greed for the private sector and advance more government control. That's where we end up.
It's funny how they blame the insurance. The Democrats do blame insurance companies, of course. But they wrote this bill, the Obamacare, in collusion with the insurance company. The insurance companies came out like bandits with this. They're like, wait a second, we get all this money and we get to, I mean, they made out like bandits. Again, are they the bad guy? No, they were just taking free gifts from the Democrats.
I think it's also probably politically profitable, right? To get all the big ones, consolidate the ones, it's more easier to control. Look at the physician market, it's the same, right? We're losing independent physicians.
Right. Yeah,
there might be political reason behind it.
No, there's another subject, and where we get into debates about site neutrality, right? And doctor-owned hospitals and things like that. We want more options, and hospitals fight real hard against that.
And also banning on the physician-owned hospitals. That's also part of ACA, Obamacare.
Well, what is, sorry?
Restriction on physician-owned hospitals.
Okay.
So basically, makes the market very uneven in favor of hospitals. No wonder independent physicians are dying.
Right. No, there was. I mean, Obamacare precipitated a huge, a conglomeration of hospitals, or consolidation is the word I'm looking for. Thank you. Speaking English better than I do. See, you were worried about this. You're just doing great. And so, okay, I think that's a pretty good snapshot of Obamacare. And I feel like we have to do that on the podcast often, because this is confusing to people. And even forget about these subsidies we're talking about right now. I mean, the premiums increased, 200-300% over the years since Obamacare was enacted?
Yes, more than double.
Maybe can I ask you something like, let's imagine a moment where Obamacare never happened. What do you think, how do you think the market was moving because it wasn't like it was great. There was a time period in America where healthcare, like we didn't even it wasn't even an issue. Now I think there's a lot of reasons that changed. One is innovation, right? We have more things that actually save people. People were just dying before. Well, now they're not. But the thing is that costs money. So I think that's one reason that nobody can control. And it's a good thing that people aren't dying. You can blame Big Pharma all you want. At least they make something that makes you not die. So that's another thing.
Actually, I disagree with that.
Okay.
I think before ACA, our market was healthy. If you look at life expectancy after ACA, we're seeing declining, and especially in Medicaid expansion states. And before ACA, individual market is very affordable. The only issue is a pre-existing condition, which is being exaggerated. However, I do think at that time, Republican could have started an initiative to create a robust safety net. But then Democrats
and that was sort of happening anyway, right?
Yes.
And that's kind of what I want to get at is like, again, imagining this alternate reality where we never passed the ACA. Risk pools or reinsurance programs, right? So just to clarify what that means for the public, it's your catastrophic insurance. My belief has always been, and I want to see if you agree with this, that you got to think about health insurance in three categories. One is primary care, and I think that should be done through direct primary care. Basically, then they call that concierge medicine, but that makes it sound like a rich people thing. But we're talking $75 a month. I'm sorry, but that's not concierge medicine. That's just access to a doctor. And less than your cell phone bill, that's for sure, and less than all of the different subscriptions that you have to Amazon and Apple and Netflix and add them all together. One day we got to consolidate all of those too, and maybe we could call it cable. Anyway, I digress. So, okay, I lost my train of thought. But where was I?
So insurance, they should not cover everything.
Right, yeah, okay, three elements of healthcare, sorry. Direct primary care. You gotta have a doctor. Here's what I can be for. I can be for a doctor or a nurse practitioner for all. Not Medicare for all, but a doctor for all. That would be a better Republican tagline, because that's achievable with something like direct primary care. And if you have universal HSAs, which we don't, but it should be easy. It should be just as easy as getting a Social Security number. It should just be that. Now, other Republicans would say, forget that. I mean, just make it a universal savings account. This is the Kevin Brady idea. That's also a good idea. There's a lot of that gets complicated on taxing, but it's an interesting idea. It would be the same thing. And then, based on your income, you get that subsidy. Not the insurance company.
Yourself.
You get the subsidy, and you can spend it on a primary care doctor. I keep forgetting. Do we get that into the big beautiful bill? We did. We got to win, right? I've been working on this for years, which is to allow health savings accounts to even pay for direct primary care. We got that. We got it. We're still working on making sure that Medicaid can pay for DPCs as well. I want the DPC market to flourish. I don't know what your opinion on. Okay, you like that. Thank you. That makes me feel good because you're kind of more of an expert on this than me. The second thing is insurance. And that insurance needs to be, it needs to be for your broken leg. It needs to be for your temporary problem that you've experienced. It cannot be for catastrophic care, because if it is, that means that premium is super high and that deductible will be everything's high, because that insurance plan has to account for everything. And so the third pillar has to be reinsurance or risk pool, whatever. And that's the only place, in my opinion, maybe not the only place, but the main place where government comes in. So now you've allowed, that's a proper protection for insurance companies, right?
Yes.
I mean,
protection of patients.
Yeah, because so patient's cancer, whatever, something that's just catastrophic, and insurance just is just, it's too expensive for it. That's where reinsurance comes in. That's where, and that's a much more definable, just easy to understand, and I think manageable system. Would you agree?
Yeah, and this kind of define the contribution, patient-centered, let patients control money approach.
Right.
Will really transform the market.
And people say we can't trust them. People say we can't trust patients. They don't know what they're buying.
That's wrong. Individual patients are the king in decision making, not anybody else.
Yeah.
Because for other people, healthcare is a business. They're making money. but for patients, it's their life.
And I would say, I agree with you. I also I'm sympathetic to this notion that it's hard for patients, but also we can fix that.
Yes.
Because you can keep the ACA website, by the way. You can just keep it, but we can make it very clear on what this plan does this for you. It does not do this for you, right? They have star ratings. There's ways to do it so that it's clear. And that's also why the DPC, the direct primary care physician, is so important to you. That's why it's the first step. Because you know who does understand this stuff? Your doctor. And so that's why a doctor is the first person you got to just pay a small fee for every month. I do it. By the way, members of Congress, all these members of Congress have direct primary care. Do you know that?
Wow, I did not know that.
Because we have a house physician. And if we want to use the house physician whenever we want, right, for whatever reason. Now, it's not insurance, right? He can't fix my broken leg, but he can prescribe. He can just I'm sick. I'm like, I'm sick. Why am I sick? He's a primary care physician. We pay a yearly fee for that. That's what direct primary care is. And a lot of companies do it for their employees. And now all their employees have peace of mind. They can be like, oh, I just call my doctor and that's it. I don't even call my insurance company. I don't call anybody. I don't think about money at all because I just have a doctor all the time.
Yeah.
And that's preventive medicine. It keeps people out of the ER. I could go on and on about this. Very passionate about DPC.
But I reject the notion that the patients have no power facing the...
No, you have to give it to them.
Once the patients control their dollars,
right,
all the providers will innovate and try to compete to make patients understand what's going on. If you look at the plastic surgery or the surgical centers facing cash-pay patients, they put their price, bundle the price, quality measures, and even have pictures showing where you do the surgery, give you a bundle price.
And there's so many others like that too. There's a lot of standalone kind of knee replacement. Mm-hmm. There's a lot of those. You're right. Yeah, I mean the market works.
And also then you raise a great point. If you let patients control their money, they will directly and personally benefit from better health and cheaper price. That will completely transform the market.
Right. Well, it's like we were talking about your son before. I don't want to get too personal, but it was like, oh, you mentioned you wanted to join the military, and I was, and happy to inform you that you can do LASIK or PRK and then go to, because you do need 20/20 vision. But I went to Buds with not 20/20 vision. I was the very first, I had 20. It wasn't bad, not like it is now, but I had a bomb blow up in my eyes, so that's kind of why it's bad now. PRK ain't gonna save that. But I was the very first students and Buds to be allowed to start that process of getting your eyes fixed. You could do it before, but you had to somehow make it through Buds without being able to see. And then once you were a teen guy, you could, I think they would give it to you. I don't think we have a great system, but we figured it out. But your son can do it. I'm telling you right now, it's okay.
And because insurance does not cover that surgery price keeps declining, and the quality goes up.
That's why I brought it up, because that's one of those things that when people talk about getting LASIK or PRK, it doesn't blow their mind. They're not like, oh my God, it's impossible to afford. No, it's not impossible to afford because it's one of those things not covered, and so it's reasonable. Dentistry, I guess, dentistry still feels a little expensive, but it's not crazy, right? I guess it depends on what you're getting done. So, okay. I mean, these are all really important principles for people to understand, because the healthcare debate, man, it gets complicated, and we get bogged down into these crazy discussions way too often. Okay, and we haven't even gotten to these subsidies. Okay, so what are we talking about here? Let's talk about the scope of what these subsidies are. So in 2021, because of COVID, the Democrats passed the American Rescue Plan. No Republican votes, right? Because just to refresh people's memories, we had already put out a ton of rescue plans. The PPP program, I think, was very successful. Could have been better. A lot of fraud, but you needed it to save the economy, and I think it did. But you didn't need more. And so as soon as President Biden took control and we lost the House and the Senate, Democrats immediately went with their first reconciliation bill, which was the American Rescue Plan. There was a lot of stuff in that, mostly just a ton of money just thrown out to the people. Vastly increased demand in an environment where supply was restricted because of lockdowns. Democrats locked down cities and supply chains. Low supply, high demand. What does that create? Massive inflation. Okay. But what else did it do? They wanted, because they felt people were in need and out of jobs, they added more subsidies than there's already subsidies up to the 400% poverty level, right? So that's about $60,000 a year for a single person. It's about, for a family of four, how much is it?
100.
About 120. So it's, I mean, like, you can live. It's not a ton of money, but like we're usually talking about a younger population here. In any case, the idea, well-intentioned, I'll give them that, I guess. It's well-intentioned, but, the idea is that a lot of people are out of jobs. There's a lot of turmoil from COVID, although by this time the economy was really recovering, so honestly not a great argument at that time. In any case, what they did was remove the cap. So instead of 400% poverty line, it was
removed.
just gone. I mean, just anybody could. And so that added a bunch of people, some of which making $300,000, $400,000, $500,000, $600,000 a year, getting subsidized healthcare plans. Why? I don't know. I guess they don't have an employer plan, but who knows? And then that was just meant to be temporary COVID era relief. Okay, you can almost forgive for that kind of crap, but then in the next big reconciliation bill, the Inflation Reduction Act, they renewed it, and now they're set to expire in December. Hence the crazy debate right now over the shutdown and all that. So that's what led us here. Because Republicans, and I know you believe this because you wrote it at your op-ed pretty clearly, were like, hey, these were meant to be temporary subsidies, and they're really for the more well-off. I mean, people aren't losing insurance. We're just saying that people above the 400% poverty line might have to pay a little bit more. And by the way, they're paying more mostly, and I would say 92% mostly, because of other factors. The Congressional Budget Office has, and I know I'm kind of answering all the questions for you, but I want to set the table for everyone. Congressional Budget Office has already scored this and said that only 8% of any premium cost increases are even due to these expiration of subsidies. That is a wild number. That is the Democrats just lying about. So doubling your premiums, millions losing their coverage. I'll let you take it from there. What do you?
The increase in premiums are caused by the structural problems of ACA, not by the premium tax credit expiration.
The same reason it's been increasing for years,
Exactly.
right? It's the same structural problems.
And also more and more people realize that they're not getting good deals, so they're migrating out of this.
So healthy people are getting off, which means more sick people on the plans, which means more cost to the insurance companies, which means higher premiums. It's a death. That's what they call the death spiral.
Right. Yeah. Basically, I would say it deceived American people into the very unaffordable plan by giving them an illusion of affordability. It's fake.
It's an illusion of affordability, and this is what we talked about. Because you're not giving the people the money to spend.
Right.
You're giving the insurance companies the money to mask. It's a masking mechanism.
Yes.
And
And
so
now they're seeing the actual unaffordable plans. If the plans,
Well, they have for a while.
if these plans, if without subsidy, nobody's buying them. Nobody's buying. You have to use subsidy to lure people in, or use mandate to force people in.
Yep. And I mean, okay, it's rough. I don't know if there's a deal to be made. I mean, like our position and my position is, I'll talk about this subject, this extremely complicated subject. It should be on our committee that we talk about it. Well, unfortunately, there's really 3 committees that do healthcare in Congress. It's kind of a silly thing. I wish there was we should consolidate that into one, but that's a whole separate civics issue. But we should debate it. I mean, we should talk about it. And what I would offer, and I won't name the Democrat who I hung out with like last week, and we were arguing about this, and he's not on the committee of jurisdiction on this, but he's a doctor. And I'm like, here's the deal. We put the subsidies in the patient's HSAs. And he's like, I love that. But we can't get it done on the Democrat side because most Democrats, now I'm talking to a reasonable Democrat who actually knows healthcare, he's a doctor. I'm like, man, let's introduce that bill. Let's do it. Because in that, but I think the thrust of the party won't let it happen, but I'd like to try.
It's really a conflict of either we subsidizing the institutions or we subsidize individuals, right? That's really the Democrat-Republican fight, I feel. Republican trying to put patients as close as possible to physicians.
And the other fight is means testing. I mean, like originally Obamacare at least had some means testing at the 400% poverty level, and now they just took it all away, and they want to keep it forever.
And that will kill the market for affordable options.
Yeah.
Once you have
And diverse options. It kills all of the options,
Totally.
right? Like
Yes,
there's no
yeah.
incentive for
And
these
you-
group plans, like the association plans, these more dynamic plans where it's like,
No.
hey, I don't want all of those things because there's no way I'm going to have a baby. I'm not going to have a baby. I don't need that. Like,
I got all the free stuff, the subsidized, the cheap, so fake cheap plans. Why should I look around?
yeah, somebody's paying for it. It's called the taxpayer, or our future grandchildren, paying off that debt somehow. So then let's talk about like what catastrophe these things expire. What happens? I mean, we're like, who's actually affected here? Because here's the Democrats. Here's Bernie Sanders. Millions of people kicked off insurance, doubling of premiums. That's their answer. How would you respond to that?
So the people who are being affected are higher income Americans. As we said, more than 400% poverty line.
Yeah.
That's more than 120,000 for a family of four.
Yeah.
Of course, we understand these are not wealthy individuals.
Yeah, they're not super wealthy.
But many of them have already access to employer-sponsored plans.
This is interesting. So first of all, it's not millions, right? It's 1.6 million.
And only 7% of the ACA enrollees in total.
Right. 93% untouched. So they don't like to say that. And what you just alluded to is interesting. And a lot of them have access to employer plans. This gets to another massive problem with Obamacare that really has nothing to do with, the subsidies make it worse, of course, or these new subsidies make it worse, but it's this incentive to just get people enrolled. There's all these like ghost enrollees, as we call them, and apparently there's like a whole broker market that kind of like gets people and hey, get enrolled. But these people already have insurance, and so they're getting enrolled, and and a third of them, as we found out, have never filed a claim. Mm-hmm. So, and this happens in Medicaid too. And so your average American would think, well, okay, well if they're not using the healthcare system and it's not costing the taxpayer money, right? Well, no, you're wrong. Because that subsidy still goes to the insurer based on how many people they have insured. It's not based on claims. With Medicaid, that money goes to an MCO, a managed care organization. So you are still losing money, even though that person doesn't even know they're enrolled in Medicaid because they got a job or something. Like they don't even know. And some people are scamming. Like some people lie about their incomes. The Inspector General found reports of that too, right?
Yeah. So taxpayers are being fleeced 4 times. I say first is to subsidize this benefit for higher income Americans.
Yeah.
The second is really giving money to those fraudulent activities. Now actually we have about 10% of the enrollees are falling into that category, 2.3 million.
We know that are fraudulent, like they're fraudulent, like claiming incoming. That's from the CBO. So they're like, we already know that.
Yes, that's number 2.
And what's our enforcement mechanism when we find that out? Do we kick them off? Like, I should know that, I guess.
Yeah, I'm not sure what we're going to do.
You know
but
that?
Anyway, that's taxpayers money.
There is no enforcement mechanism as far as I can tell, right? They're like, we don't have a really good way to kick people off once we've realized they've lied. I mean, that's insane.
Yes.
I got to fix that. Okay, I'll add that to the list, Jerome. For the audience listening, and Jerome is our legislative director in the room.
And then number 3,
he's Joe Rogan's Jamie, right? Yeah.
So this is the second time being fleeced. The third time is Obamacare, a junk insurance with outrageous premium. People are not actually getting healthy. So then come back being paid by taxpayers again. And the last part is that ACA, where Obamacare, made the commercial insurance price higher. Mm-hmm. The hospital price.
How does that work? You mentioned that. So, explain that,
yes,
please.
through consolidation.
Consolidation.
Insurance consolidation, hospital consolidation makes the price high.
It kind of creates a price floor, but also like employer health plans kind of explain why they have to kind of follow the Obamacare increase in premiums. Like, why do they have to? What makes them do that?
So the major component of healthcare spending is hospital price, right? Hospital price. So Obamacare made hospital price higher. Why? Through consolidation. So think about the banning on physician-owned hospitals. That's part of ACA. So before ACA, physician-owned hospital have been flourishing. But after that, they
Why?
can't.
I've never actually understood. I should know this. Why? What's the steelman argument, the good argument for saying physicians can't own hospitals?
I heard it's a political horse trading at that time.
That's weird.
Yeah,
Why does it matter? I don't understand why it's even.
Because the hospital industry did not want physician-owned hospitals to compete with them. And our own studies found that physician-owned hospitals are actually cheaper for the same service in the same country.
Yeah, so they want businessmen to own them. It's just a weird rule.
Right. So that's one thing, right? To increase consolidation,
Yeah.
give favor to hospitals.
Yeah, that was how they got them on board because,
Right.
I mean,
And
to get Obamacare passed, they had to get, when you're dealing with healthcare issues, as I know in politics, like they're all against each other, which is, in some ways is good. It would be scary if they all agreed. But the pharmacy benefit managers, the big pharma, the insurers, the doctor groups, the patient groups, the hospitals, they all butt heads. And we just, as policymakers, we just kind of have to figure out who's telling the truth and then
Right.
do what's right for the patient.
And the second thing, don't forget the 340B program. 340B program was expanded by the ACA.
Oh, okay.
Gives upper hand to hospitals, right? This buy low, sell high program, you get a lot of money.
340, quickly, 101 on 340B program, lower cost drugs, right?
Right.
so-
So the eligible hospitals get this discounted drugs
Yeah.
from manufacturers and then sell at a normal price. So it's buy low, sell high, keep all the margin.
yeah.
But then physician
It's supposed to be
cannot
for it's
have
supposed
that.
to be for like our low income hospitals, and we have
Right.
those in the Houston area it's called Harris Health. It's supposed to be for them, but your bigger
Exploded.
hospitals do get it also, and they claim it's for we do get uninsured people too, and then that's the claim. But again, we can't go. We don't have the enforcement mechanism to go into their books
Right.
and figure out it. And every time we think of changing some of this stuff, they scream like, "Wait, we're going to lose our business. The hospital will shut down." It's like, I don't think it will. Maybe now the rural health hospitals maybe have more of an argument, but and one of the ways we got our big bill passed was by putting $50 billion into rural health. How that's going to work out is maybe another podcast. But I think it's the right thing. I'm not sure what your feelings are.
That's the second example, right? The third example is ACA added a lot of regulatory burdens on players.
Yeah.
So if you are facing high regulatory compliance burden, only the big ones can survive.
Right.
So that's why.
So those same regulations we talked about earlier,
Yes.
they don't just apply to ACA plans; they apply to all plans, ERISA plans, like your work, your
the providers also.
So that just when you reduce flexibility, you reduce choice. There's no incentive for competition. There's no pricing signals. You don't have a market. Quick, you know what? I'm going to move back real quick because I'm curious. I've never been move back to ACA 101. The gold, silver plans. What's up with these? These are confusing as hell. How do they plan all of this? These different levels of plans.
So that's different coverage and different the out-of-pocket levels.
Okay.
Yeah.
So there's some choice, but it's like they're all what's your opinion on that?
Those are not organically generated choices. I call them fake choices.
Yeah. Yeah.
If we let the market work, we would have such a vibrant, dynamic
Yeah.
insurance market providing plans to meet diverse patient needs. Now we don't have that at all.
Yeah. Okay. So it's just they're one. There was something in here about I think we did it in our bill just recently.
Yes, you allowed the catastrophic plan
That's what
for
we did.
people above
Yeah.
30 years old, right? Older
Okay.
than 30 years
Yeah.
old.
So explain that.
Yeah, that actually is not an actual catastrophic plan. Before ACA, what was catastrophic? The plans only cover insurable events, meaning that they are major, unpredictable, involving large financial outlays. Right?
Okay.
So that if we only cover those items, the premium is very affordable. So
Yeah.
ACA changed that, and they call this kind of high deductible plan catastrophic, which is not. It's just a high deductible plan, but still have to cover a lot of things.
Yeah. Okay.
So it's not really affordable.
And so the thing we changed in our big beautiful bill was for gold plans to allow catastrophic care.
Yeah.
So you have to explain.
That is actually good move from our big beautiful bill. Before, only people younger than 30 years old can access that. But now it's everybody can access that high deductible plan, what they call catastrophic plan.
Yeah, and that kind of gets back to my original philosophy. If I were to start our country over and create a health system, like going back to those 3 pillars, I mean, you know, whether you call it life insurance or reinsurance or risk pooling, that's what the government steps in, and that's what keeps premiums low, and that's what keeps your access to your doctor. Okay, that's helpful. You know, the other, you were going to say something. Go ahead.
Yeah. So because now we expanded the eligibility for the catastrophic plan, and then we also add the HSA eligibility for the ACA plans, all through the big beautiful bill. I think that is a viable option
Yeah.
for many people who are going to lose the subsidy going forward.
Yeah, we did. We got the DPC and HSAs, and you can pay for your own ACA premium out of.
Right,
I
before
can't
you
believe
couldn't,
I
yes.
can't believe you couldn't do that before.
No.
Yeah, I mean, our next step is to have universal. I don't know how to get an HSA. I do this policy for a living. I don't know how to get an HSA. How do you get an HSA? Do you have to have like a certain?
Now you have to
I literally don't
match.
even know. Like everyone should just have it.
Exactly. Now you have many restrictions. You have to have a high deductible plan to match it.
Yeah.
And if you're a gig worker, you cannot have it
That's insane. I mean, it should just be.
for everyone.
And there are some Democrats who agree with this, but like they're just, you know, unfortunately the main thrust of the philosophy there is they want single payer, and they make it very compelling, and it's easy to. Here's the hard part. Like we've had a very complicated discussion in the last hour, and that's how because healthcare is complicated, and if you're gonna have an honest conversation about it, it's gonna be complicated. Democrats don't like. What they are very good at is emotional reasoning and emotional propaganda, and it's very easy to say like guys, like look, wouldn't it be just forget all these complicated different plans that you have to sift through. Your insurance plan covers everything, and that's it. And everyone's like, yeah, I like that. I don't have to think of it. I have too much other shit to worry about. That seems like a great idea. It does until you start picking back all the layers of the onion and realizing how it destroys a market. And you do need a market, right? That's the thing about healthcare. It's like it's not a right, but it is a service we want. And so that means there has to be some kind of government help to like lift it up. It's just like affordable housing or food stamps. Just there are needs that people have, but you still need a market. And because I regret this, right? I wasn't as well versed as I am now in this and in the art of healthcare debate. But I remember I was on Joe Rogan's show like maybe my second time or third, I don't know. And we were talking about healthcare. And this was back when he was a lot more liberal, and it was always taking like Bernie Sanders' side on everything. But he kind of stumped me. He's like, I don't get it. Like, why can't like healthcare just be like it's like a firefighter? It's like a fire station. Like just everybody pays something into it, and then it puts out in fires. And I like tried to think of some like super academic economic like models about like common goods and things like that, and that didn't really answer the question. I thought about it later, and I was like, there is an easy answer to that question. It's because the fire station doesn't have to innovate.
Exactly right.
It doesn't have to innovate, and it only really deals with one fire at a time. If you had a whole neighborhood catch on fire, it would not work. And by the way, in healthcare, that's what happens. Also, firefighters don't have to keep seeing the person, or they don't have to keep going back to the house, right? It is a very simple service that really doesn't require any innovation. Healthcare requires massive innovation because we're constantly trying to figure out like how do you cure. We haven't cured cancer, we haven't cured Alzheimer's, so you have to have a market to do that, and we're like the last country even doing it, right? I mean, don't we have you probably know the numbers. I think we have like access to like 60% more drugs than other countries.
Yes.
We have higher prices, and it sucks, and that's a debate to be had. But people have to understand at least the fundamentals of why that is.
Yeah, we need more market, not less market. We need less government.
Yeah.
So the innovation and competition are the only way to bring actual affordability and access to American people. If you look at the technology advancement across industries, technology advancement is collapsing prices everywhere.
Yeah.
right? And think about the online storage, everything. But why is not yet into healthcare? That actually is depriving American people the opportunity to strive, save, and live a full life. To me, that's a tragedy at the personal and the societal level.
What do you think? A lot of people ask me about, they're like, there's like this whole movement right now, which I think is good, kind of revealing all the nutritional science that I think was wrong for so many years, and people are really getting into like these longevity formulas and peptides and supplements, and I think it's all good, and like proper eating, getting these ingredients out of food. Now, I do think there's a lot of false hope there. Like just because you make that ingredient illegal, don't think you're not going to be fat, brother. Like just stay away from that aisle. Did you ever think that food was healthy for you? Let's be honest. But putting that aside, I do think there's a lot of good information out there now that there wasn't before.
But our system prevent people from getting benefit by living a healthier life or choosing a cheaper option.
Yeah. Well,
See,
insurance doesn't reward you for it.
Right.
Yeah.
If I'm a medicated patient, even if I stay healthy, I get all the healthy food, I work out, what kind of benefit can I get?
Yeah.
I cannot get any additional financial benefit, right? And beyond that, I'm being restricted to a very narrow networks. So current system is actually disadvantaging the people really in need.
Yeah, and you get a benefit if you're a good driver for your car insurance, right? You get if you're a bad driver, you get a lot of tickets, you crash a lot, well, your insurance is higher. It's not that different. I hate comparing people to cars, but the analogy works fairly well.
Yeah, you're taking incentives away from people. And then you blame people saying, okay, you got unhealthy. That's because government create the policy failures causing people not healthy.
Yeah. What's your opinion on how pharmaceutical companies? What I was going with that is, I get asked a lot. Okay, did big pharma like try to hide this information from us all these years to keep us sick and keep us on drugs? And I'm like, I don't see any evidence of that. I think usually the answer is incompetence, and honestly, we just didn't know. We just didn't have the science. And they're like, well, why is this stuff? And people ask, well, why is it legal here and illegal in Europe? And I'm like, I don't know. I think we just don't care. I think that's the answer. I think we just haven't gotten to it yet. People want to hear some big conspiracy, but I'm like, I don't think there is. I think we just, I'm not saying it's a bad idea, and I don't agree with you. I just not sure. You asked me why it didn't happen. I don't know. What do you think?
I think it's because the coverage is too generous. If you think like Medicare, right, with protect the class, every single drug has to be covered. That is wrong. Then you take the value assessment from individual patients, saying you get all the drugs. Why shouldn't I take?
Yeah. Well, I'm asking a slightly different question that maybe is like just kind of it's very off topic, but I get my point that I want to make to people is. The answer is usually incompetence and stupidity, and much more so than like an organized a criminal activity. But I do like to see this new movement, and maybe it's MAHA, or MAHA can mean a lot of things. To me, it just means like healthier eating, fitness, lifestyle, and there's a lot of ways to keep yourself healthy without even going to the doctor's office.
And I think underlying this movement is a recognition of individual responsibility and how much we can do as individuals to improve our health.
Well, it needs to be that. I'm not so sure it is, because again, I don't like this false hope of like, hey, if we remove this ingredient or red dye, then everything's gonna be fine. No, it's you.
Exactly.
You are fat because you are fat. That's it. That's it. You're unhealthy because you're unhealthy. It's you. It's 100% you. Don't tell me you thought Cheetos were healthy. Oh my God, I didn't know. Big Pharma lied to me. Nah, bullshit. You knew they weren't unhealthy. You just like them. Let's be honest. Yeah. So I tell like anybody who's like a MAHA activist, I'm like, make it about personal responsibility too, 100%. Please. Like it has to be. It has to be. That's the future.
And that's the core of American dynamism, right?
Yeah, it is an American identity issue. I agree. There was like one more thing before we like have to go. I thought maybe we covered it all. No, I think we did. I mean, let's see. We got to what happens if they actually expire. And like what the truth is, and this doubling of premiums and all that nonsense is just not true. I don't know was there anything else you wanted to add?
I just want to add, we now have direct primary care and we have direct specialty care. We are seeing a very interesting market dynamic right now. A lot of new things, for example, crowd sharing or cost sharing ministries, right? Many or short-term plans, association plans. These innovative options are going to invade the market, penetrate the market.
But they can't. But they're having trouble because of these extra subsidies.
Exactly.
Is one of the
That's
points
my
you're
point.
making.
And the regulatory constraints.
Regulatory constraints. So there's like two things Congress needs to do. Well, there's a bunch, but big one. HSAs for everyone. Okay. Removed the regulatory constraints that force this conformity amongst insurance plans. Really, nobody should be against that. Insurance companies shouldn't be against that. So I don't think we'd face a lot of opposition, except from the Democrats who demand, destroying the system so that we can get to a single-payer system. And third, putting money into the patient's pocket, and then just allowing these other different kind. Under Trump's first term, right? We remember those fights. So we're getting those short-term duration plans allowed, and Democrats are like, those are junk plans. It's like, no, they're a plan for someone who needs it for that.
Exactly.
Like it's something called a junk plan. It's like they know what they're buying. I mean, it's just they have just a wildly different philosophy on this, and it's utopianistic. It's good intentions, but it doesn't work. And just look at Canada, look at UK. It's like, you do want a 6 months wait time for an MRI? It's like, yeah, okay, they have a cheaper drug. They have that specific cheaper drug, but guess what? Also, they don't have access to, which is all of our new cutting edge biologics that are, immunotherapies that will cure cancer. You have to go to Houston for that. So, be careful what you wish for. If healthcare was as simple as firefighting and all it required was, okay, you're unhealthy, here's your Band-Aid. You could make a good argument that it could be totally government funded, just like the firefighters are. That's not what healthcare is. It's more complicated. People have to come back. It's patient-centered. It's very complex.
And we have a great opportunity to deliver true affordability and access to American people. I really love your point of HSA card. Like, everybody has it. Think about what happened to
with a debit card associated with it.
Right.
I mean, it's so easy.
Think about what happened to the 401k.
Yeah.
Once people left pension, they're not going back. So once people have control of their healthcare dollars, either earned or subsidized, they would love it, and that will totally transform our whole healthcare market.
Yeah, you look at your
and our health.
It'll make them feel better. It would be politically popular if you saw your bank account just like looking like, I got to spend that money. And yes, guess what? Your premiums are going to be more expensive, but you have money to pay for it. Here it is. Right. And you get to choose. Imagine that. And that's what I want my daughter to grow up in. I try to tell the story of what I want my daughter to grow up in. And she looks at her apps and she finds her DPC, and some are $80, maybe one's $120 a month because, they went to Harvard or some shit like that. But most are 75 is about the average, right? They find their DPC. That direct primary care doctor helps her, get the insurance that makes sense for her. And then that insurance is ideally affordable. Why? Because the government did step in, but not in the way ACA or Obamacare does, but with reinsurance and risk pooling, which happens at the state level. And we've seen that, right? Some states states can still do that. And we've seen premiums decrease in those states, as far as I understand. Real quick, the last thing I want to mention, what Republicans tried to do, and another reason you can't trust Democrats on this issue, we put in cost-sharing reduction into the One Big Beautiful Bill. And what's interesting about cost-sharing reduction is somehow it saves the taxpayer money, even though you're actually reducing the cost share for the patient. It doesn't make sense on the surface, but you peel back the onions, somehow it actually saves us money. And you can still explain it better than I can. Jerome over here, we've talked over it a number of times, but you're familiar with what I'm talking about, I'm sure. The Democrats raised hell over it and raised it out of order, even though it shouldn't have been, as it was clearly budgetary in nature. I hate that parliamentarian in the Senate. I think she should be fired, but
I think that's where the clash is, right? Democrats have this idea that government should arrange healthcare. And then the result is the incentives all aligned to government. So every player has to comply in order to get the money. But on the Republican side, the idea is to let the patient be the center. Then everybody has to serve the patient's best interest, make patients happy to get their business.
It's so
that
rare
will
that we
totally
find
change.
that cost sharing reduction thing. Like, it's impossible these days to find a solution that has no trade-offs.
Right.
This thing literally made things cheaper for patients and saved the taxpayer money. And the reason Jerome, why was the real? Why did it's because it's counterintuitive. Jerome, quickly.
Yeah, so the reason it saves money is because it reduces out-of-pocket costs post with less utilization. So it's an appropriated payment, which is why it was birded out by the parliamentarian, because it technically is not mandatory, it's discretionary. But it paid out to the insurance companies to reduce premiums. And then when those payments ceased in 2017, what happened is the plans did silver loading. So they jacked up the price of their cheapest plan, their benchmark silver plan, and then in response to those payments stopping, and then premiums went through.
So it saved the taxpayer money because actually helping subsidize cost sharing relieves the burden of the increase in premiums, and so there's less need for a subsidization of premiums. That's why, right?
Exactly.
Okay.
It comes with agreements with the insurance companies, as well as kind of like minute changes to Medicare Advantage upcoding and that sort of thing that make it into a pay for.
Yeah.
You reduce spending on this.
And now maybe it would have been birded out because of the appropriations issue versus mandatory spending issue anyway. But the fact that Democrats fought it, I think, just tells us something. Like they fought that. Remember, I mentioned the lower cost, more transparency act. Why fight these things? Why fight these things that are bipartisan, perfect solutions for reducing healthcare costs? Because in the end, you want to break the system. They want to break the system so that they can create the system they want, which is a socialist single-payer system. And that's the real, I think, just horrible trick played on the American people.
Yes, and I think we have a choice. Either we go to the road to serve them or road to freedom.
Yeah.
And we are going to fight the war in healthcare. Thank you for our leadership.
We're going to go. One more question. You're at a prominent university and you're very outspoken about what's that like? Being a professor there and you know, all schools are liberal. So what's
Actually, Johns Hopkins is actually very open-minded. They support my work.
Yeah.
And they give me a very open environment.
That's fair. You know, we've had a few Johns Hopkins people on. I guess you're probably right.
And last year we had a conference. We had the market-oriented conference. We have Senator Cassidy. We have Mr. Hearn.
How do students respond to your teaching this kind of stuff?
Students love it because our students all students.
So we need to hire
actually-
more Johns Hopkins students
wanna-
because they're learning from the right people.
Thank you.
I mean, they're learning something totally different in another public health school. I don't even know at Harvard. I mean, I went to Harvard Kennedy School. I mean, Harvard Kennedy School was actually pretty decent. I had a lot of Republican professors. I think they try to maintain some balance. I think the students are always trying to unbalance it. But the other graduate schools, like the health policy, I forget what it's called, but that it's crazy liberal. Like, there's no way there's somebody like you hired there. I mean, and if there is, I take it back. I'm sorry, Harvard, but show me who they are, and I'll have them on the podcast.
But not.
But you know what? I want them on the podcast with a super liberal one. I want them as a debate. That would actually be a good podcast.
But you know that now it's very easy to learn, right? You don't need to be the student. Like, people can learn from your podcast. Yeah. And I think at the end of the day, everybody want to know the truth.
Yeah.
Know the fact.
So okay, we'll end there. How can people? Do you have are you on social media a lot? Do you put out a lot of writings? How can people find that?
LinkedIn and X.
Okay, and how do you spell it?
G by DC.
Okay.
My X.
Okay.
And then LinkedIn, find me there. Google my name. G by.
Okay, we'll put it in the comment section too.
Thank you so much.
Yeah, thanks for being on. Super.
What an honor.
Well, honor's mine. Appreciate your work, and op-ed you wrote was. We'll put that link in there too. Everyone should read it. It was a really solid argument. Wall Street Journal editorial section is still pretty awesome. So thank you.
Great. Thank you for leadership, Dan.